Hey everyone, how's everybody doing today? I hope you guys are doing okay. I hope you guys are staying healthy. I hope your families are doing okay. I'm very sorry for the long hiatus. Obviously, there's a lot of things going on, and um, I really do apologize for that. But I hope your NCLEX reviews are going strong, and I hope you guys are hanging in there. So, today I just want to fairly quickly go over um, I want to go over the heart and its anatomy and physiology since we all know that the cardiac system does play a big role in the NCLEX, right? And sometimes a lot of people do kind of forget the basics, which allows us to have, kind of a macro overview of the cardiac system, right? So this is just a quick, recap and basically like an exercise of the full view of our of the heart base and its anatomy and physiology. Okay, now as we all know, the heart is composed of specialized tissues that contracts and relaxes in a coordinated fashion, right? And uh, these tissues are actually like fibrous tissues, and um, this is where the great blood vessels are connected into, right? And this outer surface of the heart is what we call epicardium, right? Now, um, the endocardium is obviously the inner surface of the heart that comes in contact with the blood, okay? And the heart muscle itself is what we call the myocardium, okay? Now, the pericardium is basically a thin, fibrous sac that basically surrounds the heart surface and serves as like a protection for the heart, right? And the contraction of the heart muscle is what we refer to as systole, right? And systole is basically the phase of the heartbeat when the heart muscle basically contracts and pumps blood from the chambers into the arteries, okay? On the other hand, relaxation of the heart muscle is what we call the diastole, right? Now, let's talk about the chambers of the heart. Now, the chambers of the heart are the atria and the ventricles, right? Now, the left ventricle basically provides blood to the entire body. Therefore, its wall is basically thicker than that of the right ventricle, right? Now, I want to talk about the valves, okay? Now, we have the pulmonary, the aortic, the tricuspid, and the mitral valve, right? Now, the pulmonary valve is obviously located between the right ventricle and the pulmonary artery, while the aortic valve is located between the left ventricle and the aorta, okay? Now, the tricuspid valve is located between the right atrium and the right ventricle. And lastly, the mitral valve is located between the left atrium and the left ventricle. Okay? Now let's talk about the SA node, or what we call the sinoatrial node, right? Which is basically what we know as the pacemaker of the heart. And it basically has an intrinsic rate of about 60 to 100 beats per minute, okay? Now, basically, the SA node is consists of cluster of cells, right, in which the electrical impulses are basically generated in this area. Okay. On the other hand, we have what we call the AV node, right, or the atrioventricular node, which has an intrinsic rate of about 40 to 60 beats per minute. Okay, and basically, it's in the AV node. Is where part of the electrical conduction system is of the heart is, and it basically helps with the um, the conduction of the atria and the ventricles. Okay. Now, like I said, the intrinsic rate of the AV node is about 40 to 60 beats per minute, while while the intrinsic rate of the SA node is 60. to 100 beats per minute. Okay, now let's talk about the bundle of his, right? So the bundle of his are basically specialized muscle fibers in the septum that carries the impulses to the Purkinje fibers, right? And this is where it terminates and results in the contraction of the muscle, right? And basically helps with the contraction of the heart. Okay? Now, when we talk about stroke volume, what is stroke volume? It's basically the amount of blood ejected in a heartbeat, right? And with with the diastole, that's when the AV or the atrioventricular valves open, right? Uh, which causes returning blood from the veins to the atria and to the ventricles, in which the ventricles will then relax, right? That is what we call diastole. Now, on the other hand, systole is when the AV valves close and the ventricles contract. Okay, so diastole is when the AV valves open, right, and the ventricles are relaxed, while systole is when the AV valves are closed and the ventricles contract. Okay, and preload is basically the end diastolic ventricular volume. Okay, that is what we call the preload, while the afterload is basically the tension in which the ventricular wall occurs during contraction, right? So that is what we call the afterload. Um, don't forget that there's also what we call ejection fraction, right? Ejection fraction is a big thing because it basically uh, it's the measure of the myocardial contractility um, and basically percentage of blood emptied from the ventricle during a certain contraction. Okay. Now, lastly, we're going to talk about cardiac output, right? Basically, the cardiac output is the amount of blood pumped by the ventricles during a time period, right? And it equals the stroke volume heart rate, okay? And lastly, I want to talk about depolarization and repolarization. Now, with depolarization, the inside of the myocardial cells basically becomes less negative and contraction of the myocardium occurs, right? It's the depolarization of the myocardial cells. On the other hand, repolarization, repolarize, right? The inside of the myocardial cells becomes more negative and relaxation of the myocardium occurs. Okay, so with depolarization, basically less negative and contraction of the myocardium occurs, while during repolarization, the myocardial cells become more negative, right? And the relaxation of the myocardium happens. Okay, so it's depolarization is more of a contraction, while repolarization is the relaxation. Okay, and I just want to quickly go over those um, important terms. I don't want to do a separate video on uh, cardiac diseases and medications that I do want to go over with you guys in the next few videos. So I just want to keep it short and sweet and simple for now. Again, guys, thank you so much. Uh, I really miss you guys. I hope your reviews are doing okay. I'll be posting every single day from now on. At least I will try to, and put up more content and really help you guys. So this is it for now. I'm gonna sign off. Thank you so much for everything. I really do appreciate you guys. I will talk to you soon. God bless.